everyone, my name is Michelle. I'm from Pain-Free Physiotherapy and Aligned Health. Do you have back pain that trouble your work or your life? Do you feel like your back is giving away? Or are you afraid of coughing or sneezing, or even just picking up our rubbish on the ground? If your answer is yes to any of this, you might consider getting our back brace for support. So our back brace is designed for people who have weak or unstable lower back. Our picture here can help us to understand what our back brace does. So there we have our whole body, which can be divided into three parts. They are the upper body, the trunk, and the lower body. Well, these two springs here represent our body in its normal state and when we have back pain. So normally, the middle part of the spring, which means our trunk, is relatively stronger and stable enough to support our whole body, while the upper part and the lower part of the spring is relatively looser, which means that it allows our upper and lower body to move freely. So every time we move our body, it's just like pulling these two springs from both ends. So the looser part of the spring tends to have more movement, therefore most of our movement will be generated from our arms and legs. However, when people have back pain, it tends to have an opposite picture. So the pattern for people who have back pain will be the middle part of the trunk become relatively looser and unstable, while the upper and the lower body becomes stiffer. And this time, when they try to move their body, most of the movement will be generated from the trunk instead of their arms or their legs. With increased movement, the trunk becomes relatively unstable, causing instability and pain. In this case, our back brace will be very helpful to provide extra support and to provide pain relief temporarily. Now I'm going to show you how to put on a back brace correctly. Before getting a back brace, please see a physiotherapist to get suggestions, as every patient could be different. So first thing, you have to make sure that you have a layer of cloth in between the brace and your skin to reduce the chance of getting allergy. And you can see there will be two metal strays in the middle of the brace that should be sitting at your lower back. And you have to put it into a good position. And most importantly, you have to make sure that the brand logo is on the top but not upside down. In order to stabilize it, just going to put the strap in your front and fix it. Once you have orientated the back brace, then you have to provide some compression by pulling the two elastic straps on the side, like this. The compression should be tight enough, but you still feel comfortable with it. Your physiotherapist will let you know how long you should have the brace on during the day. As an example, it can be 8 hours a day for the first week, then it goes down to 6 hours a day for the second week, then 4 hours a day for the third week. And since then, your physiotherapist will let you know when you should put it on or just as required.
Michelle, so when I'm wearing the back brace, are there anything that I have to be aware of?
You just have to be mindful of getting a correct size of the back brace, and most importantly, feel comfortable with it. However, if you found out that you have any allergic symptoms or any circulation problem, please seek professional advice and take it off immediately.
Okay. If I wear it all the time, is it gonna make my core muscle weak? And am I gonna be dependent on it afterwards?
No. So with a back brace on, it actually helps to restore your muscle in a better state. That's what we call the length-tension relationship. For example, if you have a very big belly, your muscle in your trunk will be loosened up and or stretched out. However, when you put a brace on and tighten it around your trunk, your muscle is actually in an optimal length that can help to generate the force easier. And when you feel more supported and less pain with your back, it also reduces the pain inhibition to the muscle that can help your muscle to produce the force much easier as well.
Okay, that sounds good. So does it mean that I have to wear it forever?
But we are not suggesting you have to wear it permanently, but it's just a short-term pain relief and as an adjunction to the treatment when you're seeing a physiotherapist. And in the period of time with the brace on, you will be having treatment to restore your whole body balance and to strengthen your back muscles in order to get pain-free without the brace. In other words, the brace can actually facilitate the process.
Ooh, that's good.
Yeah.
Alright. Thanks, Michelle.
No worries. So if you suspect that you might need a back brace, please come and see us. We are more than happy to answer your questions. Bye!